There's a junction called spaghetti.
Oh, yeah.
Yeah.
Today's lecture. Oop. So if you were looking in my courses, looking for today's lecture notes, you may have also noticed there's a PDF file in there, which is this big long chart. We're going to be getting back into a lot of muscles now. We're going to be studying the lower limb for the rest of the semester, which is going to be very similar to studying the upper limb. There are lots of muscular compartments. So in the thigh, for example, there's an anterior muscular compartment, a medial compartment, posterior compartment. You've got the gluteal region, which is the butt. In the leg, which is below the knee, you have anterior, posterior, and lateral compartments. Then there are even muscular compartments in the foot, especially on the plantar surface of the foot, which is very similar to the palmar surface of the hand. So I thought I would try to make your lives a little bit easier by basically giving you all of the information you're going to need about all of the muscles in these different compartments. So this way you don't have to worry about going through the book and figuring out, trying to simplify the attachments. Like sometimes the book gets really detailed about its attachments, or it gets really detailed about actions of the muscle. It gives all these obscure sort of secondary and tertiary actions of muscles and things like that. So basically this PDF file spells out everything you need to know about every muscle in the lower limb, the lower extremity. Just as a tip, a pointer, I don't know if this will be helpful to anybody or not, but I remember when I was trying to memorize all of the stuff about all of these muscles in the lower limb, I found it easiest to start out by thinking about compartments. Because oftentimes the muscles in a particular compartment are going to share the same innervation and share similar attachments and even share similar actions. Now, that's not always true by any means. There are lots of exceptions to this. But I would start out by memorizing things like the muscles of the anterior compartment of the thigh. Most of them extend the knee, and all of them are innervated by the femoral nerve. Makes it a lot easier to memorize if you memorize the whole group first. But then you have to layer on the exceptions. Like the medial compartment muscles of the thigh, most of those adduct the leg. Most of them are innervated by the obturator nerve, but not all of them. But at least if you start out with sort of the big picture, memorizing the compartments, then you can add in the exceptions later. And maybe that'll be helpful to you. Okay, so that's going to be your guide for all the musculature for the remainder of the semester. All right, so now that we've finished up talking about the pelvis, we only had that one dissection on the contents of the pelvic cavity. We're now going to move into the lower limb, or often referred to as the lower extremity. The lower extremity is divided into several regions. The gluteal region, the butt region, we'll actually come back to in the next lecture. And that'll actually be part of next week's dissection, I think Monday's dissection. But mostly when we talk about the lower limb, we're referring to three distinct areas. There's the thigh, which of course is the area from your hip to your knee. The leg, to an anatomist, the leg is only the area from your knee to your ankle. So it's similar to the way anatomists have strange words for the arm and forearm up here. Most people think of the arm as being the whole upper limb, but to an anatomist, the arm is only from the shoulder to the elbow. Most of us in common usage, when we say the leg, we think about the whole thing, the whole lower limb. But to an anatomist, the upper part of the quote unquote leg is the thigh, and the true leg is really only from the knee to the ankle. And then of course, we'll be looking at the foot as well, and all of the joints, the hip joint, knee joint, and ankle joint, as well as the joints down in the toes. So today we're going to focus on the thigh, and specifically we're going to focus on just the anterior and medial compartments of the thigh, which I'm pretty sure is the subject of your dissection today. So here are the bones of that area. We've already talked quite a bit about the bones of the pelvis, so I'm not going to go back into that in any detail. So we're just going to focus on the femur and just a teeny bit on the knee joint. The muscles in the anterior thigh and the medial thigh are either acting on the hip joint or they're acting on the knee joint. The femur has a head, which is a rounded ball that fits into the acetabulum, the socket on the pelvis. The head of the femur is then connected to the rest of the femur by a fairly narrow neck area. And then you have the shaft of the femur that then continues down to the knee. Notice something about the orientation of the femur, the shaft of the femur. It's not straight up and down. The femur is at an angle. It angles inward. And the purpose of that is so that the knee joint actually lies directly below the hip joint. So the head and neck of the femur actually kind of push the shaft away from the hip a little bit. So the upper part of the shaft is actually sitting more laterally, but then the distal end of the shaft, turns in this medial direction so that the knee still lies directly under the hip joint. And that just makes it a lot easier to stand upright without exerting a lot of force by keeping all of those joints in perfect alignment. So the hip joint, the knee joint, the ankle joint are all lined up perfectly in a vertical line, which just makes it easier to stand up without having to use any effort. So that's an important thing when you're illustrating the femur. Make sure if you're illustrating the front of the body, if the femurs are visible, make sure that they angle inward as they head down towards the knees, so that the knee joint lies right below the hip. Up at the proximal end of the femur, we have a couple of large protuberances, large bony landmarks for muscle attachments. There's something called the greater trochanter. And we'll see next week that a lot of the gluteal muscles, the big muscles of the butt, attach here to the greater trochanter. There's a smaller structure called the lesser trochanter. And I don't know that I've actually mentioned that term before, but we've actually already seen the two muscles that insert on the lesser trochanter, the iliacus muscle in the pelvic cavity and the psoas major muscle in the pelvic cavity. They pass over the pubic bone and insert on that lesser trochanter to help pull the femur forward to flex the hip joint. Yeah, Sheila.
HA had that the slides are being shared with the Zoom people.
Oh, really?
Yeah.
Okay. My apologies if I didn't do that. Let me go back to Zoom here. I guess maybe not. I think I turned on the recording and forgot to hit the share button. All right, let's try that again. All right, hopefully that's better. So you didn't miss much. I did put up a copy of the muscle chart that's in PDF form on my courses, so you can just go look at that on your own. And then I just had this introductory slide. So here we're looking at this first picture of the shaft of the femur. So once again, just to point out that the knee joint lies right below the hip joint. And in order to do that, the shaft of the femur has to angle inwards as you go from the hip down towards the knee. And so then we've got greater trochanter, where a lot of the gluteal muscles attach, lesser trochanter, which is the insertion for the iliacus and psoas muscles. Down at the distal end of the femur, we have the knee joint itself, of course, and we'll come back and talk more about the knee joint at another time. But the femur articulates with the tibia at the knee joint. The fibula, which is the other bone in the leg, does not actually contribute at all to the knee joint. So it's a little different from the elbow. You remember in the elbow, the humerus articulates with both the ulna and the radius. But here in the knee, the femur articulates only with the tibia and has no contact with the fibula. The femur has a pair of condyles at the distal end, and these don't have fancy names. You might remember with the humerus that there were two condyles that had unusual shapes, so they got their own names, the capitulum and the trochlea on the humerus. But here in the knee, the two condyles of the femur are basically identical. There's nothing fancy about their shapes. So we just call them femoral condyles. There's a medial femoral condyle and a lateral femoral condyle. Just proximal to the femoral condyles are a pair of epicondyles. So that's something that was kind of similar to the humerus. Just above each condyle is an epicondyle. So one on the medial side and one on the lateral side. And then part of the medial epicondyle of the femur gets a special name called the adductor tubercle. There's a muscle in the thigh that has its insertion there. We'll talk about that more later. As posterior view of the same thing. So again, we've got the head of the femur sitting in the acetabulum to form the hip joint, the skinny neck connecting the head to the rest of the shaft. We got the shaft of the femur here. Down at the distal end, we've got the two femoral condyles, epicondyles, and then that adductor tubercle just above the medial epicondyle. Up at the proximal end of the shaft, you've got greater trochanter for insertion of a lot of the gluteal muscles, lesser trochanter for iliacus and psoas. A couple of additional features visible here on the posterior view of the femur. There's something called gluteal tuberosity that lies between the greater and lesser trochanters. That's part of the insertion for the gluteus maximus muscle, which is the big muscle in your butt. And then there's a prominent ridge that runs the whole length of the posterior surface of the femur. This is known as the linea aspera. And a number of the muscles in the medial compartment of the thigh have their insertion on that linea aspera. At the very end of the semester, on the last day of class, I'm going to do a demonstration dissection on the joints like I did with the upper limb. I will dissect into the hip joint to show you some of its structures. I'll actually disarticulate the hip joint similar to what they've done here. But notice that the femoral head is covered with smooth, shiny cartilage. So that's a layer of hyaline cartilage covering the femoral head. The inside of the acetabulum is also lined with hyaline cartilage. Plus, there's also a fibrocartilage ring that surrounds the acetabulum. That's known as the acetabular labrum. I don't think we talked about this too much with the shoulder joint, but the glenoid fossa of the scapula also has a labrum that surrounds it. It's a fibrocartilage ring surrounding the glenoid fossa that basically just helps hold the humerus in place in the shoulder. So here's a similar thing in the hip joint. You've got this labrum of cartilage surrounding the acetabulum to help hold the femoral head in place. Now, there's also something in the hip joint that really does not have any equivalent in any other joint that I can think of. There's actually a ligament in the center of the hip joint. There's a ligament that actually attaches to the head of the femur. And you can see that right here. You can see the cut end of that ligament, and it's literally known as the ligament of the head of the femur. And you can see that it attaches to the acetabulum over on the medial side. And that ligament that's actually in the middle of the joint helps to hold the femoral head in place within the hip socket. The hip joint is capable of three different kinds of motion. So the first axis of motion, or the first kind of motion, would be flexion extension. I should probably hold myself up so I don't fall over. So flexion of the hip would be this motion, bringing the femur or the thigh forward at the hip joint. So that's flexion of the hip. Extension of the hip is the opposite of that, bringing the femur or the thigh posteriorly at the hip joint. The hip joint also abducts and adducts. So abduction, of course, would be moving the femur away from the midline of the body. And then so abduction, and then adduction, simply bringing the femur or the thigh back towards the midline. So that's also occurring up here at the hip joint. The final type of motion is a rotational movement of the whole shaft of the femur. And that's going to be a lot harder for me to demonstrate because you won't be able to see my feet. But just imagine if I rotate my whole thigh so that my toes point inward towards my other foot medially, that would be called medial rotation. So it's the whole shaft of the femur that's basically twisting. It's very similar, with the humerus, we had the same thing. You had medial rotation of humerus so that the front of the humerus rotates in medial direction. So if you just look at your feet, if you turn your whole lower limb in such a way that your toes point medially rotating the femur. And then of course you can do the opposite. You can rotate your leg so your toes point laterally away from the body. Again, that's a rotational movement that's happening in the shaft of the femur. And that's also happening up the hip joint. So you have medial rotation and lateral rotation of the femur at the hip. So these three different kinds of movement: flexion, extension, abduction, adduction, and medial and lateral rotation. So let's start talking about some of the muscles involved in these motions. And we've already talked about these, so I won't go into them in a lot of detail. The iliacus muscle, originating from the inside of the ilium, and the psoas major muscle, originating from the lumbar vertebrae. The two muscles then join together to form a tendon that's often referred to as the iliopsoas tendon. So the combined tendon of iliacus and psoas muscles. And that's what's actually inserting on the lesser trochanter of the femur. These are the two most important hip flexor muscles. So both of these muscles are going to pull the lesser trochanter forward, which is going to have the effect of flexing the hip joint. There is one or actually two other muscles that help that, but the other two muscles are in the thigh. They play kind of a small role in that. So iliacus and psoas are your primary hip flexors. Both of those are innervated by the femoral nerve, by the way. The rest of the lecture, I'm going to concentrate on the thigh. And we've seen a similar picture to this back when we looked at the brachium or arm, looking at the way that the muscles of the thigh are divided into different compartments. Just to refresh your memory from when we talked about the arm, when I talk about a muscular compartment, I'm talking about a group of muscles that's all contained within a single layer of fascia or a single envelope of fascia. So you can see the gluteus maximus here, colored kind of a brownish red color. That's continuation from the gluteal muscles in the butt, which we'll talk about actually next week, and we'll dissect those on Monday. But the actual compartments in the thigh include an anterior compartment, shown here in kind of a pink color, medial compartment in kind of a bluish purple, which is obviously medial to the femur, and then the green muscles represent the posterior compartment muscles in the back of the thigh, which would be the hamstrings. You remember I mentioned when I was trying to give you some pointers about memorizing these muscles that you can sometimes think in terms of what does an entire compartment of muscles do, and there may be exceptions to that, but it's a useful way to start memorizing them, and then you can add in the exceptions later. But generally speaking, the muscles in the anterior compartment of the thigh play a small role in flexing the hip. So a small role in that motion, hip flexion. But their most important role of the muscles in the anterior thigh is to extend the knee. These are the quadriceps muscles. There's a couple others in there too, but mostly these are the powerful extensor muscles of the knee. The muscles in the medial compartment, which lie on the medial aspect of the thigh, so medial to the femur over here, I think you might be able to predict what they do. They're going to pull the femur medially, which would be adduction. And then the muscles in the posterior compartment, shown here in green, they play a small role in extension of the hip. We'll see later that the gluteal muscles in your butt, those are the primary muscles that extend your hip, especially that big gluteus maximus muscle that makes up most of your buttocks. But the muscles in the posterior thigh also help a little bit with extension of the hip, extension of the thigh at the hip joint. But the primary role of the posterior compartment muscles is to flex the knee. So they're pulling on the tibia and moving the tibia posteriorly to flex the knee. All right, so today we're going to focus just on the anterior medial compartments. Next week, when I talk about the gluteus muscles in the buttocks, I'll also be talking about the posterior muscles of the thigh, because we're going to dissect those together. We'll dissect the gluteal region and the posterior thigh, I believe, on Monday. All right, so this slide shows a superficial view of both the anterior compartment and the medial compartment. So the anterior compartment muscles are listed on the left side of the slide. The medial compartment muscles are listed on the right side of the slide. And just to kind of orient you, the pubic tubercle sits right here. So that would be just lateral to the pubic symphysis. That little white band that's going diagonally from the pubic tubercle up to the ASIS, that's actually the inguinal ligament that forms the floor of the inguinal canal. So then up here at this end of the inguinal ligament, we have the ASIS, or anterior superior iliac spine. You can see a little bit of that iliacus and psoas here, which I've just labeled iliopsoas. But the iliacus and psoas major muscles joined together, cross over the pubic bone to then have their insertion on that lesser trochanter of the femur to flex the hip. I'm going to walk through the entire anterior compartment first. I'll go through 2 or 3 different slides on the anterior compartment, and then I'll back up and walk through the whole medial compartment. And this is the way you're going to dissect the two today. You're going to be dissecting, I think, anterior compartment first and then medial compartment afterwards. So the muscles in the anterior compartment. There are 4 muscles in the anterior compartment that we call quadriceps muscles. Quadriceps literally means 4 heads. They are 4 separate muscles, though, 4 distinct muscles. I'll talk about them in a minute. But this first muscle that we're going to look at is not considered part of the quadriceps. It's its own separate little muscle. It's kind of a weird little muscle called the sartorius. It has its origin up here where I'm pointing with the cursor on the anterior superior iliac spine. It's a very narrow strap of a muscle that then wraps around the front of the femur. It crosses the anterior femur or anterior thigh diagonally, wraps all the way around the medial side of the thigh, and in fact, kind of almost disappears from view here before eventually inserting on the tibia, just below the knee. So since the sartorius originates on the anterior superior iliac spine and inserts on the tibia, it means it's actually crossing 2 joints. It's crossing the hip joint and it's crossing the knee joint. And it can act on both joints. But it doesn't do much at any of those joints. It's a fairly weak little muscle. I'll put my stool over here and maybe I can demonstrate what it does. When it crosses the hip joint, it's crossing anterior to the hip joint. So it's going to play a very small role in helping to flex the hip. Very small role. Then wraps medially around the leg, or excuse me, around the thigh. So it's got this diagonal orientation to it as it's wrapping around the thigh. So when it contracts, it's going to try to pull the anterior part of the thigh laterally. So it's going to kind of rotate the thigh into lateral rotation. So my toes are pointing laterally away from the midline of my body. So it's sort of twisting the thigh as it pulls and rotating it laterally. But again, it's doing that weakly. You have other muscles that are more powerful lateral rotators of the thigh, but it helps a little bit. And then by the time it reaches the tibia, it's wrapped all the way around the back of the knee. And so it's actually inserting kind of behind the knee joint on the tibia, which means when it contracts, it's actually going to pull the knee or pull the tibia posteriorly, which is flexion of the knee. Now, if you put all of that together, the Zoom people can't see me. Okay, if you put all of that together, this one muscle theoretically lets you flex the hip, laterally rotate the leg, and flex the knee. This is the leg crossing muscle, if anybody can see what I'm doing. So if I'm sitting down, I can use my sartorius alone to do that. Flex the hip. Laterally, I may have said medially. Forgive me if I misspoke. Laterally rotate the thigh and flex the knee a little bit. This has been described as the seamstress muscle, the tailor's muscle, the shoemaker's muscle. I don't know. Somebody who makes some kind of clothes. I forget now the exact term that probably some old-fashioned anatomist back in the 1800s gave this term, because they would go into a clothing shop, a tailor shop, and people would be sitting there with their knees crossed sewing. And so it was the knee crossing muscle or the seamstress muscle or something like that. Right, the other muscles in the anterior thigh are all what we call the quadriceps. It includes the rectus femoris and 3 muscles with the word vastus in them. Only 2 of them are visible right now. We're gonna have to go to a deeper dissection to see the 3rd one, and I'll jump ahead to another slide in just a minute. But the first of these quadriceps muscles lies right in the midline of the thigh, and it's called the rectus femoris. You can't see its origin up here because it's hidden by the sartorius. But the origin of rectus femoris is the anterior inferior iliac spine. So sartorius originates on anterior superior iliac spine, but rectus femoris, originates on anterior inferior iliac spine. If you follow the rectus femoris distally, you'll see that its tendon goes right into the patella, and then the tendon of the patella continues down to insert on the tibia. Specifically, there's a bump on the tibia down here called the tibial tubercle that I think I forgot to mention or forgot to put on my slide earlier when I was talking about the knee. But there's this little bump on the front of the tibia right here called tibial tubercle. So it's rectus femoris originates on the anterior inferior iliac spine, and I would call its insertion the tibial tubercle down here. If you look in the textbook may describe the insertion of this muscle a little bit differently. The textbook might say that the rectus femoris inserts into the patella. And then it would say that the patella then connects to the tibia by way of something called the patellar ligament. Personally, I think that's silly. I think that's a silly description, because the rectus femoris tendon was present before the patella ever formed. So as far as I'm concerned, the tendon of this muscle goes all the way from rectus femoris directly to the tibia, to the tibial tubercle. And it's always been that way since the muscle began development in the embryo. And it was only later in development, in fact, long after birth, that the patella even began to form. The patella is the best example in the body of what's called a sesamoid bone. You might remember the pisiform in the wrist is a sesamoid bone in the flexor carpi ulnaris. And there's similar confusion about the attachment. You know, some people say that the flexor carpi ulnaris inserts on the pisiform. Bullshit. It doesn't insert in the pisiform, it inserts on the 5th metacarp. The pisiform just happens to grow in the tendon later. So same thing with the patella. It grows in the tendon later. So the way I like to describe it, and I'm not sure every anatomist agrees with me, but the rectus femoris inserts directly into the tibial tubercle, and then along comes the patella later, and just happens to grow within the tendon. Then there are these 3 vastus muscles. There's one medial to the rectus femoris, one lateral to the rectus femoris, and as we'll see in a second, there's one that lies immediately posterior to the rectus femoris. We just have to get the rectus femoris out of the way. So vastus medialis originates on the femur, and also inserts on the tibial tubercle by way of the patellar tendon and the patella. The vastus lateralis originates on the lateral surface of the femur and also inserts on the tibial tubercle by way of the patellar tendon and the patella. And let me jump ahead to the next muscle. If you remove the rectus femoris, and by the way, up here in this deeper dissection, you see this little cut tendon up here that's attached to the anterior inferior iliac spine. That's the rectus femoris tendon. Here's the other cut end of the rectus femoris tendon. And so once again, we see vastus medialis originating from the medial femur, inserting on the tibia, vastus lateralis originating on the lateral femur, inserting on the tibia. And then in between the vastus medialis and the vastus lateralis is something called vastus intermedius. Now, people always get confused between, wait, there's a vastus medialis and a vastus intermedius. If you think about what the terms mean, okay, vastus medialis means the medial one. It's on the medial thigh. Vastus lateralis means the lateral one. It's on the lateral thigh. Vastus intermedius, intermedius, as in the word intermediate, means between the other two. So intermedius means it's between the medialis and the lateralis. So hopefully that makes the terminology somewhat less confusing. That vastus intermedius also, it's originating from the anterior surface of the femur because it's between the medial and lateral ones, and then also inserts on the tibia by way of the patellar tendon and the patella. Now, I haven't said anything about the actions of any of these quadriceps muscles yet. So by the way, your 4 quadriceps are rectus femoris plus the 3 vastus muscles, vastus medialis, vastus intermedius, vastus lateralis. So those are your 4 quadriceps. The rectus femoris crosses 2 joints because it originates on the anterior inferior iliac spine of the ilium or the pelvis. It's crossing the hip joint. It's inserting on the tibia, so it's crossing the knee joint. So rectus femoris is another muscle that can assist with flexion of the hip. But more importantly, it's a very strong extensor of the knee. By pulling up on the tibia, it extends the knee. The vastus muscles, all 3 of them, cross only one joint. Vastus medialis, vastus intermedius, vastus lateralis all originate on the femur itself. So they're not originating on the hip or on the pelvis, so they don't cross the hip joint. The 3 vastus muscles are only crossing the knee joint. And all they do is extend the knee. So all 4 quadriceps muscles extend the knee. The rectus femoris plays a small role in flexing the hip. But mainly these are your knee extensors. So I don't know if anybody goes to the gym and you sit in that machine and you do the knee extensions. I mean, you're working out your quads. Sure.
So if you're talking about the leg or the thigh,
yeah,
flexion is like you would be lifting.
So flexion of the thigh would be this, yeah.
But if you're talking about the leg, bottom part, extension is like.
Right, extending it is straightening it out. Flexion of the knee or flexion of the leg at the knee joint would be decreasing the angle, bringing the leg posterior, right? Well, I also haven't mentioned anything about innervation. All of the muscles in the anterior thigh, so sartorius and all 4 quadriceps, are all innervated by the femoral nerve, which you've seen in the pelvic cavity. You've seen it running right alongside the psoas major muscle. That femoral nerve is going to cross into the thigh. In fact, I have a slide that'll show that in a minute. And then it's going to split up and innervate all of these anterior thigh muscles. All right, let me go back to the first slide, and now let me talk about the muscles of the medial compartment of the thigh. So I'm going to start way over at the most medial aspect of the thigh, and then gradually work my way from the medial side, work my way laterally a little bit within the medial compartment, and then also look at some subsequent slides to go deeper, to dissect deeper into the medial compartment of the thigh. So way over here on the most medial aspect of the thigh is a long skinny muscle called the gracilis. And the word actually comes from the word gracile, which means slender. The gracilis originates on the pubic bone, right near the pubic tubercle. And it's a long, narrow strap of a muscle, very similar to sartorius, and very easy to confuse with sartorius because they're the same length and same width, very similar in shape, just very different origins. But if you follow gracilis all the way down, it crosses the knee joint and inserts on the tibia, and it actually inserts right next to where the sartorius inserts. So these two muscles are kind of converging towards one another to insert on that same point on the tibia. Gracilis is crossing the hip joint because it originates on the pubic bone, which is part of the pelvis. So it's crossing the hip joint. It's crossing the knee also, but it does almost nothing at the knee. Its primary job is to help adduct the hip. So if you start out with your thigh in the abducted position away from the body, and you pull it back towards the midline, that of course is adduction. So that gracilis is helping to adduct the thigh. Turns out you got a whole bunch of muscles that adduct the thigh, and there's 3 muscles in the medial thigh that are all called adductor something or other. But gracilis also helps adduct. Yeah, Sophie. Adducting the thigh, right? So there's lots of different ways that we can talk about the movements of the hip joint. If you say flex the hip, I'm okay with that. Probably just to avoid confusion, it might be helpful to say flex the femur at the hip joint or flex the thigh at the hip joint. Those all mean the same thing. And abduct and adduct the thigh at the hip joint, if you just want to be real thorough in the way you describe the motion. Right, so gracilis adducts the thigh or adducts the femur at the hip joint. And it can play a tiny role in knee flexion, but not much. Just a little bit lateral to the gracilis is one of these muscles that's actually called an adductor muscle. And we'll see in a minute that there are 2 more of these called adductor. And you can kind of guess from the name what they do. This one's called the adductor longus, and it also originates on the pubic bone. And if you follow it, it actually inserts on the shaft of the femur, but kind of on the posterior part of the shaft of the femur. At the beginning of today's lecture, I mentioned there was a ridge on the back of the femur called the linea aspera. So this adductor longus inserts on that linea aspera on the posterior surface of the femur. So this is originating on the pubic bone and inserting on the femur. That means it's only crossing one joint. It's only crossing the hip joint. And just because of the orientation of the muscle is definitely going to pull the femur towards the midline of the body, which would be adduction of the thigh at the hip joint. Adduction with a D. Just medial to the adductor longus is a muscle known as the pectineus. And this muscle is quite deep. It's going to be a little challenging for you to find in dissection. It looks like it should be right there, but there's a whole bunch of other stuff in front of it, like arteries and nerves and fat. But it's in there if you dig deep enough. Pectineus originates from something called the pectinate line, which we talked about a little bit last time. That's a little ridge on the pubic bone. So it's originating from the pubic bone, specifically from the pectinate line of the pubic bone. And then it inserts on the shaft of the femur along that same ridge on the back of the femur called the linea aspera. Now, the fiber direction of the pectineus looks really similar to the fiber direction of the adductor longus. So you might think that it might help to adduct, and I suppose if you read the textbook, the book might say that it plays a minor role in adduction of the femur or adduction of the thigh. But I believe its primary role is that it's another really weak flexor of the hip. So it helps the iliacus, the psoas, the sartorius, erectus femoris. Plays a very small role in pulling the femur forward, which would be flexion of the hip. I haven't finished talking about all the muscles in the medial compartment, but I want to talk about innervation for a second. Most of the muscles in the medial compartment of the thigh are innervated by the obturator nerve, which you've seen before. You saw it in the pelvic cavity, lies just medial to the psoas major muscle, deep in the pelvis. Obturator nerve is going to pass through that little obturator canal, which is part of the obturator foramen in the front of the pelvis. And when it goes through that obturator canal, it ends up in the medial thigh. And obturator nerve then innervates most of the muscles in the medial thigh. So gracilis, adductor longus, and the other two adductor muscles that we're going to see in a minute are all innervated by obturator nerve. The pectineus is one of these exceptions. It's the muscle in the medial compartment that just happens to not be innervated by the obturator nerve. It's innervated by the femoral nerve. So almost call it an anterior compartment muscle, but anatomists group it with the medial compartment, even though it has the same innervation as the anterior compartment muscles. So pectineus is innervated by femoral nerve, but the other medial compartment muscles are all innervated by obturator nerve. All right, so here again, just a little bit deeper dissection, but we're still only seeing those three muscles. You can see a little bit more gracilis going from pubic bone down to its insertion on the tibia. Adductor longus also going from pubic bone, like specifically from the pubic tubercle, down to the femur. Can't quite see it where it inserts on the femur. And then pectineus going from the pectinate line of the pubic bone over to the femur. But now on this next slide, we've got a much deeper dissection of the medial compartment. Most of the anterior compartment's been removed in this case, and we're looking only at the medial compartment. So the muscles that I just talked about have been cut. Way up here on the pectinate line of the pubic bone, there's a little flap of muscle up there. That's the cut end of the pectineus. Here's the other cut end of the pectineus, close to its insertion in the femur. There's another muscle up there on the pubic tubercle that's been cut. That's the cut end of adductor longus. Down here is the other end of the cut adductor longus inserting into the femur. And the gracilis has also been completely cut away in this slide. You can see the cut ends of gracilis up on the pubic bone and down here by the tibia. There's another muscle, unfortunately, that when Netter painted this, he cut this other muscle too. We haven't talked about it yet, so it's kind of unfortunate that Netter painted it cut, but I couldn't find a better picture that showed it intact. Immediately deep to the adductor longus is a muscle called adductor brevis. And it has pretty much the same attachments as the longus. It's also originating from the pubic bone, and it's inserting on the linea aspera on the back of the femur. Netter's shown it cut here. You will find in lab that it can be kind of difficult to identify the adductor brevis because frequently it sticks to the adductor longus. I mean, it's not really surprising. They share the same origin and the same insertion. So, and the muscle fibers are parallel. I mean, it's almost like one muscle. But there should be a fascia separation between them. So hopefully we'll be able to separate them. Other times the adductor brevis fuses with an even deeper muscle that I'm going to talk about next, called the adductor magnus. So you may have to kind of stick your finger in there and poke it around and see if you can find the separation between adductor brevis and the other surrounding muscles. The final muscle here in the medial compartment is this great big fan-shaped muscle called the adductor magnus. And you might be able to figure out why it gets that name. I mean, just looking at the orientation of the muscle fibers, hopefully it's really obvious that it's going to pull the femur medially, which is going to adduct the thigh at the hip joint, adduct the femur at the hip joint. And it's called magnus because it's just so darn big. It has its origin from the pubic bone, but also part of its origin wraps around to the back of the pelvis and has part of its origin also from the ischium, specifically from what's called the ischial tuberosity. And then it inserts all along the entire length of that linea aspera, that ridge on the posterior surface of the femur. So it has this big fan shape as it radiates out from its origin to that big long insertion on the femur. Now there's also a portion of the adductor magnus muscle that inserts all the way down on the adductor tubercle of the femur. At the beginning of today's lecture, I mentioned that the femur has two condyles, it has two epicondyles, and then just above the medial epicondyle is an extra little bump called the adductor tubercle. That's also part of the insertion of this adductor magnus muscle. That would be right down here where I'm pointing with the cursor. And there's a separation or a gap between the part of the adductor magnus muscle that inserts on the linea aspera and this little piece of the adductor magnus that inserts on the adductor tubercle. So there's this gap or opening between those two different parts of the adductor magnus muscle. That opening, that gap in the adductor magnus muscle, is known as the adductor hiatus. Now it has the word adductor in it, so you might think, oh, it's another muscle, it's a different adductor muscle. But what it means, a hiatus, if you're not familiar with the term in English, just means like a pause or a gap. So adductor hiatus literally refers to a gap or an opening in the adductor magnus muscle. And if you look real closely on the slide here, I don't know how well it shows up, but there's an artery and a vein that are passing through that adductor hiatus, through that gap or that hole in the adductor magnus muscle. That's the femoral artery and the femoral vein, the biggest artery and vein in the thigh. We'll see in a minute that the femoral artery and vein start out in the anterior thigh, but then both the femoral artery and the femoral vein poke through that adductor hiatus, through that hole, and end up in the back of the knee. They pass posteriorly to the space behind the knee. And at that point, they change names. The femoral artery and vein become the popliteal, or some people call it popliteal artery and vein. And I think I've got that name for you in a minute. I think that's written somewhere in the slides. Yes, it's on here. All right, so in addition to looking for all of the muscles in the anterior and medial compartments of the thigh in lab today, you're also going to want to look for the arteries, the veins, and the nerves. Mostly arteries and nerves. We can remove veins if they're in the way. So let's start with the nerves. Here's the femoral nerve as it continues into the thigh. You've already seen the femoral nerve up in the pelvic cavity. Saw that it lies just lateral to the psoas major, and it's usually kind of buried partly under the psoas major. The femoral nerve is going to cross under the inguinal ligament, which is that white ligament up here at the top of the picture. and enter into the anterior thigh. As you follow the femoral nerve into the anterior thigh, you might see that it's splitting into a lot of little branches, and that's normal. The femoral nerve has to split into branches because it's supplying the sartorius and all four quadriceps muscles. So the nerve, as soon as it enters the thigh, it starts to split up into these branches to those different muscles. The femoral nerve also gives off a sensory branch to the skin of the anterior thigh. There's something called the anterior femoral cutaneous nerve, which is also a branch of the femoral nerve. So, so don't be surprised if it looks like it's splitting into a million nerves, because that's exactly what it does. I don't think the obturator nerve is shown on here, but when you dissect the medial thigh, you're going to be looking for the obturator nerve, which is the main nerve that innervates the muscles of the medial thigh. So let's focus our attention now on the arteries. You remember up in the pelvic cavity, from Tuesday's dissection, the aorta splits into a left and right common iliac artery. The common iliac artery then splits into an internal iliac and an external iliac artery. The internal iliac is the one that gives off all those branches that you were looking for on Tuesday, like umbilical artery, superior gluteal artery, etc. The external iliac artery, though, is going to cross over the pubic bone, under the inguinal ligament, and enter the thigh. As soon as it crosses the pubic bone, it changes names. So the external iliac artery changes names to become the femoral artery as soon as it crosses the pubic bone and enters into the thigh. So what we're seeing here in this slide, the inguinal ligament is up here, the pubic bone would be up there. So we're seeing the femoral artery entering the thigh. So that's the continuation of external iliac. The femoral artery is then going to lie in sort of a groove between the quadriceps muscles and the muscles of the medial compartment. This is referred to as the adductor canal. But it's really just kind of like a groove or space between the quadriceps muscles and the medial compartment muscles. That femoral artery is going to continue all the way down through the adductor canal until it reaches the area just above the knee. And then the femoral artery and the femoral vein running with it are going to pass through that adductor hiatus. The femoral artery and vein are going to pass through that little opening, that little gap in the adductor magnus muscle. And when they do that, they're going to end up in the area behind the knee and change names to become the popliteal artery and vein behind the knee. So external iliac artery crosses the pubic bone to become femoral artery. Femoral artery passes all the way through the thigh, pokes through that adductor hiatus to end up behind the knee, and changes names again to become popliteal artery. And vein does the same thing. The femoral nerve, by the way, does not go through the adductor hiatus. Most of the branches of the femoral nerve are just supplying structures in the anterior thigh. So by the time the nerve reaches the adductor hiatus, there's almost no nerve left. There is a little tiny branch called the saphenous nerve that continues down to, it's a sensory nerve to the skin just below the kneecap, just below the patella. But even that saphenous nerve does not go through the adductor hiatus. So it's only the femoral artery and vein that go through the hiatus. The femoral nerve does not. Some other arteries that you're going to look for. Pretty high up in the thigh, usually just a couple inches below the point where the femoral artery enters the thigh, it gives off a big branch off of its posterior surface. That's called a couple of different names. I learned it as profunda femoris artery. A lot of the books now are using English words instead of Latin words. So they call it the deep artery of the thigh. Or I've also seen deep femoral artery. So you've got the femoral artery that's more superficial. And then there's this big branch off the back of the femoral artery that goes deep into the thigh. That would be deep femoral, deep artery of thigh, profunda femoris, whatever you want to call it. So that artery is going to plunge deep into the muscles of the anterior and medial thigh. And you probably won't be able to see where it goes because it disappears very deeply into the thigh, and we're not going to trace it. But that profunda femoris artery does give off a couple branches fairly high up in the thigh. So shortly after the profunda femoris branches off of the femoral artery, profunda femoris then gives off two additional branches that are called circumflex arteries. Remember our old friends, the circumflex humeral arteries up here around the humerus? Just means an artery that wraps around something. So these are the circumflex femoral arteries, meaning they are wrapping around the femur. There's one on the medial side and one on the lateral side. So a medial circumflex femoral and a lateral circumflex femoral. So the femoral artery, at least if you have the textbook pattern, and mostly I'm talking about is textbook, and you might not all have the textbook pattern, but if you have the textbook pattern, the femoral artery gives off the profunda femoris, or deep femoral or deep artery of thigh. It's the profunda femoris that then gives off medial and lateral circumflex femoral arteries. And of course, not everybody's going to have the textbook pattern. I've seen these circumflex arteries coming off of the femoral directly, instead of coming off of the deep femoral. I've seen them coming off of a common trunk. So there's one circumflex artery that then splits into medial and lateral. I've seen one of them come off the deep femoral and one off of the regular femoral. So like every imaginable variation that you can think of. But you know, if I tag it on an exam, I'll try to tag it on one that looks like the textbook. We got 6 cadavers, so somebody's bound to have the textbook pattern. All right, last thing. This is not really a separate compartment of the thigh exactly, but it is a muscle that doesn't fit neatly into any other compartment. It's not really an anterior compartment. It's not posterior. Actually, before I talk about the muscle, let me talk about something else. There's a muscle here, but let me talk about this thing down here. So the thigh has a very thick, very tough layer of fascia that completely surrounds the entire thigh, surrounds all of the muscular compartments of the thigh. This is known as the fascia lata, which sounds like a coffee drink. But in Latin, it means the wide fascia. Lata is the same word where we get the word latitude in geography. So fascia lata just means the wide fascia. All that means is just all of the fascia that surrounds the muscles of the thigh. Over on the lateral side of the thigh, though, that fascia lata gets extra thick and extra tough. And anatomists have actually named that thick part of the fascia lata, they call it the iliotibial tract or the iliotibial band. It gets that name from the fact that it actually attaches to the ilium, the iliac crest, proximally, and continues down to attach to the tibia distally. So the fact that anatomists actually give it a name, you know, iliotibial tract, iliotibial band, any runners here that have ever heard of like an IT band injury or anything like that? That's what they're talking about, iliotibial band. You know, the fact that anatomists give it a name, you might think that it's like this separate, distinct ligament structure that runs down the side of the thigh. It's not. It's just a thick part of the fascia that wraps all the way around the thigh. So today, as you're dissecting that fascia of the thigh, as you start dissecting that fascia laterally, you're just going to notice that it's going to get thicker and thicker until you get this IT band over on the lateral side. But it's, you know, even this, I'm not crazy about this picture because Netter makes it look like it's this distinct separate structure. But what Netter doesn't tell you in this picture is that he cut off the rest of the fascia of the thigh on the front and the back of the IT band. So that edge that you see on the front and back of the IT band is not real. Somebody made that by cutting it with a scalpel. So the IT band is continuous with the fascia lata, which is just a fancy word for the fascia that wraps all the way around the thigh. Now, up at the proximal end of the IT band, embedded within the fascia lata, is this muscle called the tensor fascia lata, and it's got an E on the end, so it probably should be pronounced tensor fasciae latae, which makes it sound even more like a coffee drink. But it's just a muscle that puts tension on the IT band. It pulls on the IT band. And by pulling up on this IT band on the lateral side of the thigh, it's gonna abduct. I used to be able to do this better. It's gonna abduct the thigh. Turns out you've got other muscles in your gluteal area that are stronger abductors, but this tensor fascia latae does help to abduct the thigh a little bit. Okay, and we're done with the slides. We're out of time. So if you didn't get your exam, I have them here.
The tensor help add up to the thigh, AB.
AB, abduct.